All right, let's talk a little bit about pacemaker malfunction or dysfunction. So when you're monitoring patients who have their pacemakers inserted or they have pacemakers, you want to have a quick look when you're doing your analysis or interpretation of whether or not the pacemaker is functioning properly. The three major things that we look at is oversensing, undersensing, and failure to capture. So we can knock off failure to capture pretty easily. So let's say creatively trying to think in my head here. Okay. Like we said, capture was evidenced by atrial pacemaker artifact immediately followed by P wave, or pacemaker artifact immediately followed by YQRS complex. Okay. In the situation here of the dual chamber, I may have pacemaker, atrial pacemaker activity followed by a P wave, and then I could actually have a spike. Actually, I'm going to put that over here. I'll give it a little bit of intrinsic activity. Okay, and so I've captured the atrium here, but in my drawing, I have a ventricular, or what we assume to be would be the ventricular because we have the AV delay here, and it fires and then nothing happens. So I didn't effectively capture the ventricle, and then later down the road, I have some intrinsic activity, and then here later down the road, I have maybe another, if I turn that to red, I have another paced ventricular beat over there. Okay, so I have some ventricular activity. But essentially failure to capture is that there's either not enough energy, and so capture, it relies on a couple of things. You have to have enough energy, and then the time of it, the duration of the stimulus. So both of these aspects have to be sufficient enough for you to actually capture the myocardium and cause depolarization. So in this situation, in this scenario where we have a pacemaker fire, but then effectively nothing happens, then there's something up with either the duration of the stimulus that's being delivered by the lead, or the amount of energy that's being delivered by the lead. And so that can be adjusted. But this would not be normal function. So we would effectively need to see capture following pacemaker artifact. So that's failure to capture. Okay, in terms of oversensing, let's just look at a ventricular paced rhythm just for, let's say, ease of my drawing. Okay, and I'm going to do this. Little intrinsic activity going on there. And then I'm going to do this. I'm going to do this. Okay. So let's assume the pacemaker captures here and it captures here. So ventricular paced rhythm, okay? This would be your automatic interval, right? I'm going to call it automatic interval. And so we know it's going to reset here and it's going to start looking, okay? So it's going to start looking, and hopefully the distance I draw is equal, okay? So we should see the pacemaker fire right about here, but we don't see anything. Luckily, we see a little intrinsic beat, so that's good. Maybe there's some cardiac output with that, but there's nothing here. But somehow the pacemaker sensed something and then didn't fire when it should have. And then there's maybe a little bit of intrinsic activity, and maybe it restarts. Maybe it restarts again. And again, this, hopefully the distance is equal. So that's auto, and this is automatic interval. So the pacemaker should fire here. Okay, and maybe it fires out there, so it's late. Okay, and then again, it resets the timing interval for the automatic interval, and it should fire somewhere here, and then doesn't. So what's happening with this pacemaker is that it's sensing It's sensing activity that isn't actually intrinsic activity, but it's misinterpreting what it's sensing as being intrinsic activity, and then it's inhibiting, so it's not generating a stimulus. So this is over sensing, okay? And what happens with over sensing is you can get these long pauses or long distances where you don't have cardiac output, or that similar to a pause, essentially. And so when I think of oversensing, if this helps you, if it doesn't, then don't remember it. But when I think of something that's oversensing, it's seeing too much, like it's seeing things that are not necessarily there, or misinterpreting what is there as intrinsic activity when really it's not, and you end up with these long moments of underpacing. So oversensing means underpacing. So I would like to see more pacing here because I'd like to have better cardiac output. You can imagine with distances like this that you're actually decreasing the heart rate, and so you're decreasing cardiac output. Okay. Conversely, for undersensing, we end up in a situation where we're actually over pacing. Like I said, if you don't like this terminology and it's confusing, just kind of ignore it and you can just memorize the terms. Okay, again, one cycle here and a cycle here that's relatively normal. So I have an atrial paced, then I have ventricular paced, and then I have atrial paced again, and then ventricular paced again. And then we have automatic intervals that reset. So this is ventricular atrial, starts to, the timing there starts just like it's like here. And then it fires. And then it resets again. And then I might fire, and then it resets again, and then it might fire. So this senses to be a little bit like asynchronous pacing, where I'm seeing too many pacer spikes. Hopefully it's not capturing, but you can see that if I did actually have a pacer fall on that T wave, I can have an R on T, which happens with asynchronous pacing, which is dangerous because you can put your patient into torsades. So what's happening here is that there's too many spikes. There should be more sensing. So it should be able to see intrinsic activity and then reset, but it's not resetting at the right time, or it's not recognizing intrinsic activity, and it's just resetting from the last thing it saw, or running the automatic interval regularly, like asynchronous pacing. And there's a risk to this because we can have pacemaker artifact or stimulus fall right onto a T wave or an intrinsic T wave and cause an arrhythmia, a tachyarrhythmia. So with oversensing, what you're going to see on the pacemaker strip is that you see too much pacing, like you'll see too many pacing artifacts where you don't want to see, because it should be resetting from intrinsic activity.